Hi, today we're going to be talking about asthma. Ow. So, so how does asthma affect the body and which organs does it affect? Asthma is a chronic inflammatory disease of the airways, meaning that it blocks your airways and you have a hard time to breathe. It's most common among children, and it's a disease of the bronchi. It affects the body because more mucus is produced when the lining of the bronchi becomes aggravated, and it turns red, and asthma becomes more difficult to handle because the bronchial muscles contract more easily than a normal airway. It blocks your airways and brings less air to and from your lungs. Mucus is produced when your airways become larger. Your airways become very sensitive when swelling increases. The small muscles around your airways start to twitch and tighten, causing less air to get in and out of your lungs. This is called bronchoconstriction. What triggers asthma? What triggers asthma? Mold, if you have any pets, if you have dandruff, if you're allergic to grass, if you smell smoke and perfume, if you have cockroaches in your home, it means that you have like it's not a clean environment. Temperature change and stress. Asthma symptoms. You can cough during exercising, coughing at nighttime, coughing while you cry, coughing while you're laughing, chest pains, dry mouth, and when you feel very tired or weak while exercising, and wheezing when you breathe heavily. Ways to reduce the risk factors: avoid smoking if you have asthma, avoid breathing polluted air, avoid allergens, be concerned about your health in general so you don't become overweight, allergies, having parents with asthma, meaning it runs in the family. Understand all the possible risk factors, that way you can try to find ways to prevent or even control your asthma and take authority of your asthma. Who is susceptible to asthma? Children are most susceptible to asthma. It's most common for children to get asthma if they have low birth rates, are revealed to tobacco smoke, and are brought up in a low-income environment. Most children start to experience the asthma symptoms around the age of 5, and it normally begins with frequent scenes of wheezing with infections of the respiratory system. How it disrupts the homeostasis of our body. It disrupts breathing. During an asthma attack, air is lost. Medication should be taken so that you can return to a normal state. Airways that are inflamed swell and produce lots of thick mucus. When airways are inflamed, it is difficult for air to get from your nose to your lungs. Not breathing can easily lead to dying. Positive and negative feedback loops. A positive feedback loop would be the medication getting to the lungs and returning back to a normal state, homeostasis. Negative is that the airways constrict due to an irritant, and it's reversed with using a bronchodilator, which is Ventolin, to relieve the symptoms to go back to normal. Another negative feedback loop is that you cannot get rid of asthma. You can only temporarily calm it down with medication. Treatments, medications. There are different types of medications. There's different kind of devices to administer the medication depending on the age. So there's a small mass for 0 to 18 months, which is this one, 0 to 18 months. The medium mass chamber for 1 to 5 years old. And the mouthpiece for 5 years plus. And then there's a large mass, which is similar to those ones. Which is similar to these ones. It's called a large mass. It's for the elderly. The medicine for the chambers is called MDI, a meter dose inhaler. It looks like this. So you put it. You take the cap off, and you put it in here, like this. Okay. The device for older kids and adults is Turbuhaler. Ventolin, which is an MDI, and Bricanyl, which is a Turbuhaler, instantaneously relieve an asthma attack. They are called bronchodilators.
Other medications, which are inhaled steroids, are taken daily as a preventative measure, which are also available in MDI and Turbuhaler. So this is Bricanol. It Okay, anyways. Yeah, I don't know.
That's how mine is.
But it looks like this. And usually when you get tested for asthma, there's a tube, and this is put on. And then you put this on your nose, and yeah, it has a little mouthpiece.
So you change it for every
patient.
yeah.
And
then this thing.
that's it. Oh, so this is. Can I show this?
Just bad.
This is a healthy. This is a healthy lung, and this is
one with asthma.
an inflamed lung. And this is inflammation, and this is a healthy lung.
But yeah, that's it. Now we Okay, that's it. Thank you. What if it shut off? No, it didn't shut off. No.